I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have another great show for you today, but before we get into the meat of our show, I'd like to talk about caring and sharing because it's so important. What I'd like to talk about today is your med moments. You know what med moments are? Those moments that, for some reason, something's just not right. Maybe it's the chest pain that just happened all of a sudden. Or if it's the shortness of breath that you're experiencing when you're walking upstairs. Or it's the knee pain that just won't let go. Those are med moments. Those are moments that let you know that you should seek medical care. You should see your doctor and talk about it. And let me know what's happening so that I can show you out there what you can do about taking better care of yourself. Well, email me, www.medmoments.com. And you can tweet me as well, @medmoments. Alrighty. We have a topic tonight that is dear to my heart because, of course, I'm a pulmonologist and I treat the lungs. We have a topic that is so important. It's called tuberculosis, and we're going to cover A to Z as far as this topic is concerned. I have the perfect person to talk about this topic. He's Dr. Lee Reichman, and he is the Executive Director for New Jersey Medical School Global Tuberculosis Institute at Rutgers. Dr. Reichman, welcome to our show.
Thanks, Omar. It's really a pleasure to be here.
All righty. I'll just let everyone know that Dr. Reichman is one of the professors and one of the doctors that helped train me in pulmonary medicine.
Yes, it was a great experience.
Oh my goodness, we go way back. And Dr. Reichman, also, with the things that you've done in tuberculosis, I understand that, you know, throughout the years, you've talked to heads of states and you've talked to many people around the world about tuberculosis. Today, I want to bring it down. I want to speak about it in a way that my grandmother could understand it, so that the community here could really understand the importance of tuberculosis.
Right.
The first question that I'd like to ask you is just basic. What is tuberculosis?
Well, tuberculosis is an infectious disease that's extremely prevalent, that usually affects the lungs, that can affect any organ, and is spread from person to person when an untreated case of TB, tuberculosis, disease, spends a lot of time with somebody else.
All right, gotcha. Is tuberculosis, what type of, it's a germ, I'm assuming, that is spread.
It's a germ. It's called a bacteria,
Okay.
which is a certain kind of germ.
Okay, all right. So it's not a virus, it's truly a bacteria. And if it's left to its, on its own, it will replicate, it'll multiply and just become, rampant as far as the body is concerned.
Well, that's what's interesting. A person who is infected with this bacteria, he spreads a prolonged amount of time with someone who has the bacteria. His body usually contains the bacteria, so nothing happens. 1/3 of the world's population, 2 billion with a B people, are infected with the bug, nothing wrong with them. But every year, 10% of them, the body doesn't contain the bacteria as well as it should, and they start getting symptoms, and that 10%, can spread the disease to their contacts, their colleagues.
All righty. That was a mouthful. Let's step back just for a minute. So there are people that may have the tuberculosis organism or bacteria, and they can, if I'm around you, I could give it to you, or however it's transferred.
Well, no. TB, tuberculosis, is a two-stage disease.
Okay, let's step.
First, you get infected.
Right.
And if your immune system is working well, and your body will then defend and keep the bugs in check so you can't infect anybody, you don't have any symptoms, you're not sick, you live a happy, healthy, normal life. You can treat it to keep you from getting further, or you don't need to treat it.
Right.
Okay? 10% of the people who have the bug in them,
Right.
for some reason, their body defenses fail to protect them.
Oh.
And then the bugs, the bacteria, start to divide. And they get a large number, and they start giving symptoms, and that person can infect other people.
Excellent. Now I understand. What about now? How does the germ get from one person to another?
The only way the germ gets from one person to another is through the air from coughing.
Okay.
So if you and I are sitting and I have active tuberculosis and I'm not coughing, I'm not going to spread it to you.
Okay. So what I want to ask is, if, for instance, if I'm drinking a glass of water and we share a glass of water, I'm not going to get
No,
tuberculosis.
absolutely not.
Or if you cough on your hand and I shake your hand,
Absolutely not.
absolutely not.
Right.
You promise.
I promise.
All right. All righty. As far as someone who is now, if I'm just sitting across from you and you have active tuberculosis and it's a short contact, would I tend to get it, or do I have to be around you a lot or a long time to get the disease?
You have to be around me for a long time. That's been calculated.
Right.
And it's found that a person who has active tuberculosis, that's the kind of tuberculosis which is multiplied and causing symptoms and things like that,
Right.
has to spend 6 months of 8-hour-a-day contact. That's 2 months of 24-hour-a-day contact.
Right.
For the individual, you, to get a 50% chance of catching it from me.
Okay. All right.
So, every once in a while there's a story about tuberculosis in the newspaper, and reporters call me up and they all get hysterical and panicked, and they say, can you catch TB on the subway? That's the question they always ask. And the question isn't no, because anything can happen in medicine. The question is yes, the answer is yes, but it's more likely the subway will crash. It's extraordinarily unlikely that you catch it in a quick encounter. You spend maybe a half hour on the subway. And that's why family members, work associates are the people most at risk. If you have a case of tuberculosis in your family, we're going to check you and we're going to treat you and keep you from getting tuberculosis from that individual.
All right.
Of course, the most important thing is once the individual with tuberculosis starts treatment, he very rapidly becomes non-infectious.
Meaning that the medicine that you're using to kill the tuberculosis germ is very effective.
It's very effective. It has to be given for a long period of time, 6 to 9 months.
Right.
But after a couple of weeks, the person's no longer infectious to his close colleagues.
Okay. Is the lung always involved in this tuberculosis problem?
Tuberculosis can affect any organ of the body.
Okay.
The lung is the most frequently, about 85%, but the bone, the brain, the spleen, the liver, any organ can be affected by tuberculosis, but the lung is the most frequently, and the lung is the only kind that can be spread to other people by coughing.
Okay. All right.
If you have tuberculosis of the bone, there's no way of getting out.
Right. Right. Now, so if I inhale these germs that someone else has given me, in order for it to get, how does it get from the lung to the other parts of the body?
If you inhale a sufficient number of the germs, remember, 6 months of 8-hour-a-day contact.
Right.
Okay.
Right.
Then it goes from your lungs into the bloodstream, and it might go to other organs or the top of the lung and sit there until then in the 10% it would start to grow. Most people, it doesn't start to grow, it just sits there.
It just sits there.
Yeah.
All righty. So it can, some people, it can get into the bloodstream and go other places.
That's right.
Oh boy. All righty. Now, I understand we had talked, you had mentioned something that was very interesting. There is a type of tuberculosis that's infection, and then there's a type of tuberculosis that's disease.
Correct.
And I want to make sure I understand this. I can be infected by tuberculosis, and I won't give it to anybody.
A third of the world's population
Right.
is infected by tuberculosis. They don't have a problem. They don't have enough organisms in them,
Right.
even in the lungs, to spread to other people.
Right. Okay.
But 10% of those every year, the body defenses that are keeping them only infected
Right.
break down, the organisms start to multiply, and the organisms start causing damage to the organs of the body, and that is tuberculosis disease.
Right.
So tuberculosis infection, no symptoms, a positive skin test. Skin test tells you if you have and I'm sure all your listeners have had skin tests before.
Yeah, you've finished,
Okay.
but I want to go through what a
Okay.
skin test is.
Okay. A positive skin test will tell you you're infected, but you have to have symptoms and an abnormal chest x-ray if you're going to have disease.
Right. Alrighty. Since you brought up skin test, let's just go through that. Because I know that people, they say, I got to go get a TB test. Alrighty. Go through a TB test and what exactly is it telling us and how do you do it?
Okay. Many years ago, TB organisms were purified and sterilized so they can't cause any problem,
Right.
and made into what's called an antigen.
Okay.
Okay? So the antigen is something you inject into the skin and make a little bubble on the skin.
Right.
And if your body is sensitive to that antigen, meaning your body has TB bugs in it,
Right.
you'll see a swelling, or your doctor will see a swelling in that area.
Oh.
So the tuberculin test is sort of a provocative test. It's got proteins from TB bugs
Right.
that your body will react with if it has TB bugs in it. So it's a diagnostic test for TB infection. But it doesn't tell us how many bugs are there.
Right.
Then the next thing, if your listeners have had a skin test, they'll say you got to get a chest x-ray. Why? Because a chest x-ray will tell you if you have a lot of TB bugs in the lung, it'll show up on the chest x-ray.
Right.
And if you don't, then you just have infection without disease.
Alrighty. So if the chest x-rays are clean,
Yep.
then I'm most likely I don't have the TB disease.
Right.
Oh, good. And that means I can't give it to anybody.
You can't give it to anybody, but you may or may not be at risk of getting TB in the future.
In the future, it doesn't mean that I can't, what we say is that your system gets down. That's a word that a lot of people say. Oh, I was out in the rain and oh boy, I've been working real hard. And my system got down and I caught a cold.
That's right.
So
Well, with TB, if your systems and your immune system is all fine, you have a positive skin test, okay, it tells you have bugs, but your body is containing. But if you get run down, if you get tired, if you get infected by AIDS, if you're on steroids, if you're on these drugs that are used if you have arthritis, that can cause the immune system not to work, and then you can get active tuberculosis.
Right. So that germ that was hiding there all that time, all of a sudden, pops up and comes alive.
Right.
All right. I understand. Tell me, doctor, what's the typical person or patient like that would come into your office that would have tuberculosis? I mean, how would they present?
Well, first of all, anybody can get tuberculosis. You know, there's a folklore out there that only poor people and minority groups get tuberculosis. Not true. I always say black, white, rich, poor, doctor, nurse, alcoholic, addict, anybody can get tuberculosis.
Right.
And one of the problems that we're seeing since TB rates are falling is doctors don't think of tuberculosis, and they treat for other things when the patient has tuberculosis, which we should say, because we haven't said yet, is 100% curable.
Oh, all right. So the medicine that we give, 100% can cure that.
If the patient
problem.
takes his medicine properly, usually for 6 to 9 months.
Yeah. See, that's the thing too. The fact that it's such a long treatment, do you find that there are certain patients that once they start feeling better say, oh, I don't need this anymore?
Oh, every patient. You know that 50% of patients, again, black, white, rich, poor, it's not related to ethnic group or anything like that. 50% of patients don't take their medicine properly for any disease. 50%. Now, most of the diseases that you as the pulmonologist treat, you'll treat pneumonia for 10 days or a couple of weeks, okay? More likely to take it. But as soon as you have to treat someone for 6 to 9 months and they start feeling well, normal isn't to take the medicine. So in TB, we're concerned, if you have high blood pressure, say, and you don't take your medicine properly, that's your and your family's problem. If you have TB and you don't take your medicine properly, it's society's problem because you'll spread it to other people. So that's why we in our clinic and the standard of care in the United States and in New Jersey is directly observed therapy. That is, if you, Dr. Omar Bey, had tuberculosis and I was going to treat you, I would insist on giving every dose of medicine to you directly. I, even though you're a physician, would not trust you to take your medicine. I would get one of my staff to watch you take your medicine. You could choose whether you'd come into our clinic or have it done in your home or your office or anything like that. But every patient with TB in New Jersey is given directly observed therapy. It is the standard of care. And that way we're sure you take your medicine, and we're sure you get cured. So there's 50% of people who don't take their medicine properly. It's not going to affect the TB population, and TB will continue to go down.
Tell me about, as far as symptoms like coughing and shortness of breath and maybe fever. Are these symptoms
All
that
of
we...
the above. Fever, chills, weight loss, night sweats, all of them, some of them, none of them can be tuberculosis.
All right. I read somewhere that it's the great masquerader. It can masquerade as many different things.
Absolutely.
All right then. As far as age, is there a certain age that you're more likely to get tuberculosis?
Well, age is related to your immune system. So when you're a child, your immune system may not be fully developed, so you can get tuberculosis then. When you're elderly, your immune system starts to wane, so you can get tuberculosis then. Not infected. It's your body defenses keeping the infection from getting the disease. So a child, that's why a child whose mother has tuberculosis, and that mother obviously is spending that over 6 months with of 8-hour-a-day contact with that kid, more likely 24-hour-a-day contact with the kid. If a mother has tuberculosis, we treat the mother, but we also watch the child and very carefully, because the child is a contact to an active case at very high risk of getting active tuberculosis. And when children get tuberculosis, their body defenses don't protect them well, and they can get tuberculosis of the brain and tuberculosis all over the body and things like that. It's really quite tragic.
So if one person is in the house, say the family, if you're a large family and you're living in a house, does everybody have to be tested in that family?
Absolutely.
And everyone in contact?
Absolutely. Every contact to a case of tuberculosis is required to be tested.
All right then,
And if they're found that they're infected, again, in fact, not yet diseased, they work them up to make sure they're not diseased, and then they treat them to keep them from getting disease.
All right. So they would get, even though they had a positive TB test, they had a negative chest x-ray, they would still be recommended for treatment.
Absolutely, if they're a contact to an active case of tuberculosis.
Oh boy, that's interesting.
Somebody who's known to have, there's certain groups of people who, if they have a positive skin test, it's required to treat them. Someone whose immune system doesn't work, like an AIDS patient, must be treated to keep them from getting tuberculosis. Worldwide, TB is the biggest killer of AIDS patients. And TB is preventable and curable. That's why it's so tragic that this is allowed to continue. In children, if a child with a positive skin test, he obviously caught it recently from an adult, so he needs to be treated too.
All right. And what if somebody who was in like a classroom, like, because school is important as well. How does the schools handle this in a sense that a child becomes positive? All the kids in the class have, and the teacher, how do we handle that?
It's not, kids when they come into the school, I believe, from a different district have to be tested once. But they don't do periodic testing because TB is so low. Teachers have to be tested, and every once in a while we have a teacher who has TB. So then we very carefully do what's called an epidemiologic study. We go and investigate what class the teacher taught in, what kids were in that class.
Right.
And we'll send a letter out to the student body, the parents, and say, a teacher, we very careful about confidentiality, has a transmissible form of tuberculosis. We want your child to be tested because your child may have caught it from the teacher. So we make sure the teacher's treated. We check the teacher's family, and we also check the students in the classes the teacher was involved in. Now, very often there's a group called the worried well. People who hear about this in the school, they had no contact with the teacher.
Right.
But we'll test them too if they want to. You know, we don't shut anybody out.
Right, right. Now, what about patients that may have different diseases, like, you know, we're very common in the hospital, heart disease, diabetes, hypertension. Does that make you more likely to contact or become a active?
Not heart disease, not hypertension, definitely diabetes, definitely smoking. There's these social determinants, definitely alcoholism, are make it more likely that someone who is infected the body defenses will break down and they'll get TB disease. Interesting,
interesting. All righty. So how do we prevent it? What can I do to make sure that I won't be one of those that either get infected or get the disease as far as tuberculosis is concerned?
Well, the first thing you're doing right now, Omar, is you're disseminating this information to your listeners here in Newark. You know, Newark at one time was #1 in TB in the country 20 years ago. And now it's down in the bottom. Why? Because there's good TB care. We're looking for TB. We're treating it when we find it. We're treating the contacts. We're giving everybody directly observed therapy, so we make sure they take their medicine. Where the breakdown is, if you say, here, take your medicine, I'll see you in 6 months.
Right.
Well, that person's not going to take that medicine.
Right.
So the most important thing is awareness. Right. And now your listeners are aware. And the second most important thing, if they have symptoms, fever, chills, weight loss, they present themselves. And the third most important thing is if they're treated for either TB disease, which is treated with multiple drugs, usually 4,
right,
that you take
4
for 2 months and then 2 for an additional 4 months. Or if you're infected, you take 1 drug, that you take those drugs and you keep your appointments, and then you won't have any problem in this community with TB.
Right, right. Tell me about as far as the TB test. Now, just going back, if I do it with my doctor and it's negative, does that absolutely means that I did not come in contact with tuberculosis and I'm safe?
Unfortunately, in medicine, nothing is absolute, as you know very well. Yes, most people, you can say that is, but maybe the person is, or he's immunosuppressed. An AIDS patient doesn't have a good immune system, and the same immune system that protects against tuberculosis makes the skin test work.
Right.
So it may not work. It may. You certainly should try it.
Right.
But you have to recognize nothing is absolute.
Right.
And, you know, if you, Dr. Bay, see the patient and he has an abnormal chest X-ray that looks like tuberculosis, and you do a skin test, the skin test is negative, that does. Your clinical judgment of that chest X-ray means that you treat that person for tuberculosis, even though the skin test is negative.
Right. Now, what about as far as I hear all the time that patients are in the hospital and they have to give up sputum?
Yeah.
What's the sputum for?
Well, one of the ways of diagnosing active tuberculosis is, you remember we said we had all those organisms in the lung,
right,
and it's coughed from person to person. So it arrives in the sputum, Although when you cough, the sputum is aerosolized. So, some of your listeners might think of, say, Right Guard deodorant, and you press the button and there's a spray.
Right.
Well, that's exactly what happens when you cough. There's a spray. You may not be able to see it, but if you have active TB, in that spray that you cough are bacteria. So if you collect the sputum, look at it under the microscope, you can see the bacteria, and then you send it to the laboratory and they give it vitamins and minerals and heat, and they culture it. That's what's called culture.
Right.
And it grows out, and then they can identify it very precisely that this is tuberculosis. And they can also identify this is the same strain that my father had, or something like that.
All right, then. They can genetically map it almost.
Absolutely.
Now, with tuberculosis, I understand that if they don't take their medications, the patient doesn't take his medication, can the bacteria get smart and become resistant to the medication that we're giving?
Absolutely. TB, if it's sensitive to the antibiotics that we use, is easily treated in 6 to 9 months.
Right.
And what we do is treat them properly. That's why we give everybody directly observed therapy. And at the end of the 9 months, we kiss them goodbye, and we're not going to be worried about him anymore.
All right.
But if he doesn't have directly observed therapy, if he doesn't take his medicine properly, the antibiotics can, as you say, very appropriately get smart and then become resistant to the antibiotics.
Right.
And then he starts getting worse, and he starts getting symptoms. And if he spreads the disease, he spreads that resistant form to his contacts.
Right. We're going to have to wrap it up, and this was excellent. I see they're telling me to wrap it up,
Okay.
but Dr. Reichman, thank you very much for coming to talk about tuberculosis.
Thank you for inviting me, Omar.
All right.
I really appreciate it.
All right. In closing, remember, never institute any medical therapy unless you go to your doctor. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all.